Persistent high fasting blood sugar. Despite strict diet, the real cause in elderly and insulin resistance, and how to fix it. Dear friends, to start with, let us review the story of a 68-year-old gentleman, disciplined, sincere, and deeply committed to his health. He finishes his dinner by 6:30 p.m. every day. No sugar, no late-night snacks. He walks after dinner, sleeps on time, wakes early. In many ways, he is doing everything right. And yet, every morning, when he checks his blood sugar, the number stares back at him, higher than expected. Not once, not occasionally, but consistently, he begins to question himself. Am I missing something? Is my body not responding? Why is this happening despite so much discipline? Slowly, frustration turns into confusion. Confusion turns into silent worry. Because in his mind, and in the minds of many, the equation is simple. Eat less, sugar should go down. But the human body is not a simple equation. What he does not realize is this. While he is asleep, in the quiet hours of the early morning, around 3 or 4 a.m., his body is already awake in a different way. His brain is preparing him for the day ahead. Hormones begin to rise. Signals are sent. And the liver, obedient to those signals, starts releasing glucose into the bloodstream. Not because he ate something wrong, not because he lacked discipline, but because his body is following a biological rhythm designed for survival. In a younger, metabolically healthy individual, this system works beautifully. The body releases just enough glucose, and insulin quietly balances it. But in someone with insulin resistance or advancing age, the same system becomes amplified. The liver releases more glucose than necessary, the insulin response is slower, weaker, less effective. And the result? A higher fasting blood sugar, despite perfect habits. This is where understanding becomes more important than effort. Because without understanding, even the most disciplined person can feel defeated. But with the right insight, everything changes. You realize, this is not failure, this is physiology. And once you understand the physiology, you can finally begin to work with the body instead of against it. Today, we are going to explore this deeply. Not just what is happening, but why it is happening, how it affects long-term health, and most importantly, how we can intelligently and effectively bring it back under control. Because the goal is not just lower numbers. The goal is restoring balance, confidence, and control, especially in the later decades of life. In clinical practice, one of the most frustrating observations, both for patients and practitioners, is this. I ate early. I fasted overnight. I followed everything correctly, yet my morning sugar is still high. This paradox is especially common in elderly individuals and those with insulin resistance or prediabetes. It challenges conventional thinking that food intake alone dictates glucose levels. In reality, the body operates under a far more sophisticated regulatory system, one that is governed not only by diet, but by hormonal rhythms, hepatic metabolism, and circadian biology. Understanding this phenomenon is not just an academic exercise. It has profound implications for long-term glycemic control, progression of insulin resistance, cardiometabolic health, aging trajectories. What appears as a simple elevated fasting blood sugar, FBS, is often a window into deeper metabolic dysregulation, particularly involving the liver and the neuroendocrine system. The dawn phenomenon, a physiological foundation. The rise in fasting blood glucose in the early morning is known as the dawn phenomenon. It is not inherently pathological. In fact, it is a normal physiological process. What happens during the early morning hours, 2 a.m., 6 a.m.? During this period, the body prepares for waking by activating several hormones. Cortisol, growth hormone, glucagon, catecholamines, adrenaline, noradrenaline. These are collectively called counter-regulatory hormones, because they oppose insulin. Their primary function, to ensure that adequate glucose is available in the bloodstream upon waking, even in the absence of food intake. The liver becomes the central organ. These hormones signal the liver to increase gluconeogenesis, creation of glucose from non-carbohydrate sources, increase glycogenolysis, breakdown of stored glycogen. This results in a rise in blood glucose before waking. In healthy individuals, the pancreas responds by releasing just enough insulin. Glucose remains within normal range. Why the problem is exaggerated in elderly and insulin resistance. The issue is not the presence of the dawn phenomenon, but its exaggeration. Key pathological factor: hepatic insulin resistance. In insulin resistance, the liver becomes less responsive to insulin. Even when insulin is present, the liver continues to produce glucose. This leads to unrestrained hepatic glucose output during early morning hours. Aging amplifies the problem. In elderly individuals, multiple physiological changes occur. 1. Reduced insulin sensitivity. Skeletal muscle and liver respond less effectively to insulin. 2. Altered circadian rhythm. Cortisol rhythm may become dysregulated. Evening cortisol may remain elevated. Morning surge may be exaggerated. 3. Reduced beta cell function. Pancreas produces less insulin in response to glucose. 4. Increased hepatic fat, NAFLD prevalence. Fatty liver increases gluconeogenesis, worsens hepatic insulin resistance. Why early dinner or fasting does not fully solve the problem. This is a critical misconception. Many patients believe, if I don't eat at night, my morning sugar should be low. However, the liver does not sleep during fasting. In fact, fasting activates hepatic glucose production. Hormonal signals override dietary input. Cortisol and growth hormone drive glucose production independent of food intake. Thus, even with early dinner or prolonged fasting, the liver continues to release glucose. The sequence of events clarified. It is essential to understand the correct physiological sequence. 1. Cortisol rises, circadian signal. 2. Liver increases glucose production. 3. Blood glucose rises. 4. Insulin is secreted in response. This means glucose rise is not the cause. It is the consequence of hormonal signaling. Impact on glycemic control. Chronic elevation of fasting glucose has several downstream effects. 1. Elevated HbA1c. Even a modest increase in fasting glucose significantly contributes to overall glycemic burden. 2. Increased insulin demand. Pancreas must produce more insulin daily, leads to beta cell exhaustion over time. 3. Worsening insulin resistance. Persistent hyperglycemia, glucotoxicity, creates a vicious cycle. 4. Increased glycemic variability. Morning spikes set the tone for the entire day. Impact on health in elderly. This is where the issue becomes clinically serious. Cardiovascular risk. Elevated fasting. Glucose is associated with endothelial dysfunction, atherosclerosis, increased risk of myocardial infarction. Cognitive decline. Chronic hyperglycemia is linked to impaired neuronal metabolism, increased risk of dementia, inflammation, and oxidative stress. High glucose, increased reactive oxygen species, accelerates aging processes, sarcopenia, muscle loss. Insulin resistance reduces anabolic signaling, leads to progressive muscle wasting, sleep disruption. Elevated nocturnal glucose can impair sleep quality, further worsens hormonal imbalance. Why this must be addressed. Proactively. Many individuals ignore elevated fasting glucose if post-meal readings are acceptable. This is a mistake. Fasting glucose reflects hepatic and hormonal dysfunction, not just dietary imbalance. It is often the earliest marker of metabolic disease, a predictor of future diabetes progression. Clinical insight. In practice, Addressing fasting glucose requires targeting the liver, modulating hormonal signaling, improving insulin sensitivity. Diet alone is insufficient. Transition to therapeutic strategy. At this point, two important interventions come into focus. 1. Metformin. 2. Black seed oil, Nigella sativa. These represent a pharmacological approach, a nutraceutical, metabolic support approach. Both primarily influence hepatic glucose regulation. In the next section, we will go deeper into exact mechanisms of metformin and black seed oil, dose optimization, timeline of effects, long-term outcomes, 3 to 6 months and beyond, how they complement each other, practical clinical guidance for elderly patients, safety, monitoring, and physician coordination, scientific references and evidence synthesis, a powerful conclusion for patient motivation. The morning rise in fasting blood glucose is not a failure of discipline. It is a reflection of underlying physiology. The liver, guided by hormonal rhythms, continues to produce glucose, even in the absence of food. In elderly individuals and those with insulin resistance, this system becomes amplified and dysregulated, leading to persistent fasting, hyperglycemia, and long-term metabolic consequences. Understanding this mechanism transforms the approach, from blaming diet to targeting physiology.
Targeting hepatic glucose output, metformin, black seed oil, and integrated strategies for better outcomes in elderly and insulin resistance. Reframing the therapeutic goal. From part 1, we established a critical principle. Morning fasting glucose is primarily driven by hepatic glucose output under hormonal control, not just dietary intake. Therefore, effective intervention must reduce hepatic glucose production, improve hepatic insulin sensitivity, stabilize the background metabolic environment. This is where two interventions come into focus: metformin, black seed oil, Nigella sativa. They operate on the same organ, the liver, but with different strengths and mechanisms. Metformin, the hepatic regulator. Primary mechanism. Metformin acts predominantly at the hepatic level, inhibits gluconeogenesis, activates AMP-activated protein kinase, AMPK, reduces hepatic glucose output overnight, improves insulin sensitivity in the liver net. Result: a lower fasting baseline glucose before the dawn surge begins. Secondary effects: mild improvement in peripheral insulin sensitivity, reduction in intestinal glucose absorption, possible benefits in gut microbiota. Clinical effect size: fasting glucose reduction, 25-40 mg/dl, HbA1c reduction, 1.5%. This makes metformin the most effective first-line agent for fasting hyperglycemia dosing strategy. Typical approach: start 500 mg once daily with dinner. Titrate gradually, 500 mg, 1000 mg, up to 1500, 2000 mg day. For fasting glucose specifically, evening dosing is particularly useful. Targets overnight hepatic glucose production. Time to effect: initial improvement, 1 to 2 weeks. Significant effect, 4 to 6 weeks. Maximal stabilization, 8 to 12 weeks. Safety considerations: gastrointestinal discomfort, common initially. Vitamin B12 deficiency, long-term. Renal function must be monitored. Black seed oil, metabolic modulator. Primary active component, thymoquinone. Mechanisms relevant to fasting glucose: mild hepatic gluconeogenesis, insulin sensitivity, oxidative stress and inflammation, possible improvement in hepatic fat metabolism. Clinical effect size: fasting glucose reduction, 10-20 mg/dl, HbA1c reduction, body down 0.7%, less potent than metformin, but biologically meaningful. Dosing: typical 2 to 5 ml day, 1 to 1 teaspoon. Best taken evening or bedtime. aligns with overnight liver activity. Time course. Early effect, 2 to 4 weeks. Stronger effect, 8 to 12 weeks. Stabilization, 3 to 6 months. Advantages: natural anti-inflammatory, supports long-term metabolic health. Minimal side effects, generally. How they complement each other. This is the most important integration point. Metformin. Strong suppression of hepatic glucose output. Black seed oil. Background metabolic improvement. Reduces inflammatory and oxidative burden. Combined effect. Layer intervention. Hormonal signal lifestyle, chanting, sleep, light, liver output, primary, metformin, liver support, secondary, black seed oil, together. Lower baseline plus reduced reactivity plus better metabolic stability, expected combined outcome. Over 3 to 6 months, fasting glucose reduction, 30-50 mdl combined variable, reduced variability, improved HbA1c, better metabolic resilience, impact on insulin resistance. With consistent use, chronic hyperglycemia, insulin demand, beta cell stress, leads to gradual improvement in insulin sensitivity. Specific benefits for elderly. Reduced cardiovascular risk, improved metabolic stability, lower inflammation, potential protection against cognitive decline. Practical integrated protocol. Morning. Light exposure, walking, chanting, HPA regulation. Evening. Early dinner, light activity, walk. Night. Magnesium, black seed oil, optional. Metformin, if prescribed. Important clinical advice. Always individualize dosing. Monitor O fasting glucose, O HbA1c, O renal function, O B12 levels. Scientific references. Key evidence base. 1. UKPDS study group, metformin in type 2 diabetes. 2. American Diabetes Association, ADA, standards of care. 3. Foretz et al., cell metabolism, mechanism of metformin. 4. Rena et al., diabetologia, metformin pharmacology. 5. Meta-analysis on Nigella sativa, multiple RCTs. 6. Katabi et al., Journal of Endocrinology and Metabolism. 7. Bamosa et al., clinical trials on black seed. Medical disclaimer. This lecture is for educational purposes only. Metformin must be taken only under medical supervision. Dosage and suitability depend on O. Kidney function, O. Overall health status. Supplements should be discussed with a healthcare provider. Conclusion. The elevated fasting glucose seen in elderly individuals and those with insulin resistance is not a failure of discipline. It is a reflection of underlying physiology, particularly hepatic and hormonal regulation. The body is not malfunctioning. It is following its programming. The problem is that the programming has become exaggerated and dysregulated. By understanding this, we shift from frustration, clarity, from trial and error, targeted intervention. The deeper insight. Cortisol sets the signal. The liver determines the output. Insulin tries to restore balance. The solution is layered. Regulate the signal, lifestyle, rhythm, mind. Control the output, metformin. Support the system, black seed oil, nutrition. Concluding message. Even in aging and insulin resistance, the system is modifiable. With the right understanding and consistent application, morning glucose can be improved, metabolic health restored, and quality of life enhanced. Thank you. Founder. Holistic Wellness Foundation 2, IMFAL. Healing Beyond Boundaries.